Okay, well, welcome everyone. My name is Anna Kiley, and we are excited to have everyone join us today to either watch the recording after or, perhaps you weren't able to make it to our training yesterday or today in May 2025 for our teacher workshop on public health in the schools initiative. So this is a project aimed at bringing public health awareness to Montana schools. So as I mentioned, my name is Anna Kiley. I'm the operations manager for the Montana Public Health Training Center, which is housed within the School of Public and Community Health Sciences at the University of Montana. And prior to public health, I was a middle school and high school science teacher for just shy of a decade. So I bring some experience both in public health as well as from the education background to this project. And so I'd like to take a moment to have the rest of the team that's here introduce themselves as well. So I am going to send it to Kristen.
Hi, everyone. I'm really excited to be here and thanks for being here today. My name is Kristen Cram, as Anna shared, and I'm a program manager for a program called REACH, which stands for Research, Education on Air and Climate Change Health. And this is housed in the School of Public and Community Health Sciences at the University of Montana. Lots of mouthful words there, but yeah, it's part of my life. Anyway, I'll pass it on to Kayla.
I'm Kayla Schomer. I'm the instructional coordinator for the Public Health and Safety Division at the State Health Department and the Train Montana Administrator. And before I made the jump to public health 2 years ago, I taught a variety of different subjects in several different states. And I am kind of our representative from the state. And to the left of my face on the screen is Allison Sheeler, the public health workforce program coordinator, and she cannot be here today, but that's us.
Thanks, Kayla. And last on our team is Dr. Ward.
Hey everybody, my name is Tony Ward. I'm a professor in the School of Public and Community Health Sciences at the University of Montana.
Great. So today we are here to cover a bit about our initiative, and the majority of our time will be spent introducing you all to our curriculum, showing you a couple of tips and tricks, and then we'll wrap it up with our next steps and where we intend to take this project next. So to start, I'm going to send it back to Tony to talk a little bit about how this program came to be, the background, and really kind of the why of this initiative.
Thanks, Anna. So this program has grown out of, I guess, a couple of different efforts. And I'll start with talking about a program that Kristen and Anna will talk a little bit more about in a second, called the Montana Purple Air Program. So this is funding from the Montana Department of Environmental Quality, where they're putting out air samplers throughout high schools throughout the Montana. And the idea is that during when you look at the monitoring network for air pollution, there's typically air monitors in the larger areas of or the larger cities throughout Montana. But when you look at the rural communities, they don't have any type of air monitoring system out there. And that's important when, let's say, there's a smoke event and schools have to make a decision on whether to cancel practice or hold practice indoors or whatever. And when they're trying to make that decision, they're looking at data, but that data is being collected 100 miles away. So this Purple Air network that's being established is really meant to develop an early warning system and a more informed decision-making system based on the impacts of wildfire smoke on communities. So in theory, every single high school in the state of Montana will be getting outdoor air monitors. Now, we also have a grant that's funded through another program here at the University of Montana. And they're providing also indoor air samplers to be sited at those schools at the same locations where the outdoor air samplers are. So you'll have that indoor-outdoor data available to the schools. So this program, Public Health in the Schools, is kind of building off of that network of air monitoring system throughout Montana. And another thing, or another reason that we developed this program, is to directly address the public health workforce shortage throughout the state. And even before COVID-19, the public health workforce was, already starting to struggle with being able to have an adequate workforce in place to address all the health issues that we deal with in our rural state. And as a result of COVID-19, we've actually had a lot of people leave the field of public health. And our intention with this Public Health in the Schools program is to build off the fact that also public health is not being taught within schools throughout Montana. So we want to develop this new program, and which you'll hear about today, called Public Health in the Schools, that is introducing what public health is and introduce that to the high school students and middle school students, hopefully at some point. Talk to them about what COVID-19, what public health is, and how it's not about COVID-19, and that public health impacts, students on a daily basis, whether that's breathing in clean air, excuse me, or drinking clean water, or living in healthy communities. So the intention of this curriculum is not only to address, raise awareness about what public health is. It's going to make connections with the local health departments in your community. Also, it will leverage the air monitoring network that's being set up in your community as well, and help you interpret the data that's being collected. And Kristen will talk a little bit more about that. So it directly addresses the workforce shortage of public health professionals also in our state. So I think that's all I was going to say, Anna.
Great. Thanks very much for that background, Tony. So a bit more about our initiative. There are several components, and this is made possible with funding from Kayla and Allison and their team in the Public Health System Improvement Office at DPHHS. The first of which, and really in no particular order, is these community health fairs. So the health department, the state health department determined 10 target communities across Montana where they believed, the communities would really appreciate, be receptive to, and be good target audiences for community health fairs. So we've been working on getting those organized. I'll show a couple pictures in just a moment of those community health fairs. Another part of our initiative is we are hoping to connect health departments with schools so that we can provide the opportunity for students to hear from public health professionals. So classroom presentations, there's career spotlight videos that Kristen will show in a little bit. And just, again, the opportunity for students to see real public health people and understand that that could be a career interest perhaps for them. The bulk of the program is in our public health curriculum, which I won't say much more about because Kristen will talk about that in just a moment. And then, of course, the teacher workshop, which is where we are today, and we hope to repeat again as after you all have had an opportunity to start implementing some of our curriculum. So in terms of progress, our workshop is underway. Presentations, we've already had some facilitated. So we've had public health experts present to students in Helena. So we have a Helena teacher here with us who was able to be part of that in Libby and in Butte. And then we have ongoing conversations to bring more public health professionals to additional schools. Our curriculum is complete and it's undergoing final review. We're going to actually talk a little bit about what those next steps of curriculum implementation will look like. And then, as mentioned, those community health fairs. So you can see there are several that we've already had the opportunity to take part in. And then we have a few that are still coming up that we're eager to get those going. Here's some great pictures of some of these health fairs that we've already participated in. So you'll see some students up from Browning up in the corner, some students at Libby Loggers right there in the middle, Phillipsburg and Drummond students at the bottom. So we just have really had such a fun time engaging with students across the state and each of these health fairs has really been very community driven. So each one has looked a little bit different based on the needs, desires, and really what the teachers and health departments in those communities were hoping for. So that kind of has added an extra element of fun for us because we get to take different approaches for each of these health fairs that we've been able to facilitate. And with that, I'm going to kick it over to Kristen to tell you more about our curriculum. And I will advance your slides as instructed, Kristen.
Great, thank you, Anna. So yes, my role in this program, this initiative, was to mainly develop the public health curriculum. And the skills that I bring to the table that kind of qualified me to be able to do this was the fact that I did get my master's in public health from the University of Montana about a year and a half ago. And actually, when I started developing this curriculum, it was only 6 months after I had graduated. So all the course material was still fresh in my mind. All I had to do was kind of apply it and try to make it so that it would be appropriate for the understanding of high school students. Along with that, I felt like I could still leverage the relationships I had built with my professors from my graduate program. And so I did do that and asked them to review the lessons that fell under their expertise. Along with this, realizing that I have no formal teaching background, I did lean on some of my colleagues pretty heavily on making sure that the curriculum was appropriate for high school students and had enough engagement and, addressed certain aspects. And this included Anna, she's a formal teacher, Kayla, as well as a few others who are not even on this call today. And they have been a huge help in making sure that this would be fun, but also informative and good for high school students. So when I was tasked with this, initially Tony said, develop lessons for the 5 core public health disciplines. And that's exactly what I did. I try to crank it out over 3 to 4 months. And after completing everything, I felt like there were parts that were missing that needed to kind of make this curriculum more comprehensive and full. And so with that, I felt, it was really important to place these lessons in the context of public health. And with that, I developed the Introduction to Public Health lesson. And I really tried to make this super engaging and active. And I actually had a teacher pilot this in her class. And one of the feedbacks that she provided that I really liked was that, it was the start of a new quarter or new semester. She had a class full of new students that she didn't know. And this was a perfect icebreaker lesson because it's meant to get the students up, go around the room, place, matching names to titles and things like that. And this teacher adapted it to fit her classroom's needs and, whatever else, and created like a relay race out of it. So that's another big component with this curriculum is it is comprehensive, but it's also meant to be adaptable. And it's also not meant to replace anything you guys are doing in your classrooms already. It's meant to complement what you're teaching. And so with that, it could be as simple as taking, a question out of a lesson that you liked and you want the students to do, or it could be, just one worksheet out of several worksheets that are under one unit. You could really just adapt it to fit your class's needs. Along with this, as Tony mentioned, we are pretty close with people who work on the Purple Airs in the Schools initiative. And, they're already going to all these schools around Montana. We only felt it was appropriate and important that we kind of leverage those connections already. And so with that, we decided to also create a Introduction to Purple Airs lesson. And this is, this initiative that they're doing is putting Purple Airs in and outside of schools all over Montana. That does not necessarily mean those receiving the Purple Airs will really know how to use the data or make informed decisions based on that data. And so I felt, we felt as a team that it was important to create this lesson so that teachers in the schools know how to use the Purple Airs. Oh, before you move on, Anna, I'll say that there is a recommended order for this curriculum. I do have it all laid out in the curriculum when you open it, but this is the order on the right here. And given that, I really want to place the core disciplines under the context of public health, you can switch those however much you want, but I do want to emphasize the importance of teaching the Introduction to Public Health lesson first so that the students really understand what public health is and not just through the lens of COVID-19. And that's all I'll say. Thank you. So again, without having any formal teaching background, I had to rely on research to figure out, how to develop a lesson, how to develop a curriculum. And along with my other role with the REACH program, that program had also developed curriculum, and they used what's called the 5Es lesson plan model. I did some research on this model and found that there's a lot of scientific journals out there that have support the effectiveness in teaching and student retention of the material from this model. And so that's exactly what I use to kind of plan out my curriculum and develop the lessons. So with that, I'll really try to skim over these ease steps because I'm sure some of you already know what they are. So I'll just get started. The first one is engage, and this is really consisting of trying to pique the interest of the students by having them have their own discussion, or maybe you have a picture up to kind of spark discussion. Whatever it is, the students are having their own kind of thoughts and forming them on their own without any teacher guidance. Moving forward, it's the explore section. So this is really where the main part of the learning takes place. And, this can take a lot of forms, but how I develop the lessons is mostly in the form of worksheets and working through problems. Then after that is the explain. And in these lessons, I mostly did that with the students having a discussion in front of the whole class and explaining their thought process and working through that explore section. Next, which I think is also really important, is the elaborate. So applying what they learned from the explore section and, into new problems that are similar, or even into something that's in a real life scenario, real life application. That's kind of what I really try to do with these lessons, connected to something that has happened in Montana or is happening in Montana, and kind of make this a very Montana-based curriculum, but of course, meant for everyone. Lastly, the evaluate. It's important to understand and know how your students learned this material and how much they retained. And so this could be as simple as a reflection and writing about what they learned, or a quiz, which I have implemented both in this curriculum. And so with the curriculum, and we'll show you some examples here in a moment, there's kind of a format that follows pretty consistently throughout all the lessons. First being a unit cover, next being a teacher's guide, a PowerPoint, and depending on the unit, there might be a worksheet or multiple worksheets. And so some examples I'll show you here in a minute. For example, this is the unit cover specifically for the environmental health unit. You'll see firsthand that you'll see the grade level is meant for, the topic, air pollution, air respiratory health, and the length of the lesson. And, this is kind of more of an estimate. It may be shorter or longer once you guys actually implement it, if you do it fully, without just like taking bits and pieces of it. So when you open this unit cover, you'll see a lesson description. This is a good way for you to decide if this is something you want to teach, or maybe not so much, or whether it's complementing something you're already teaching in the class and you can just add on to it. That's important for teachers to look at. Also, learning targets. So knowing what the students will learn from doing this lesson in its entirety. And, they'll still learn many of these even just through portions of the lesson as well. Next is the inclusion of American Indian Alaska Native content. In the state of Montana, this is actually a requirement for curriculum in Montana. But not only that, we do feel it's important. And so this is about addressing the historical context of American Indians and Alaska Natives and relating that to the lesson and how it's important for them as well. Prior student knowledge. There could be students of all the same grade, but they have different knowledge of at this point in time. And so kind of knowing where your students are and reading this kind of can help you decide whether they're ready for this lesson, or maybe, needs to be pushed back a little bit after they learn some of these knowledge and skills. Next one is possible preconceptions and misconceptions. So this is really just trying to address anything that students might be thinking of prior going into the lesson. For example, this first one, I have an example of like respiratory diseases. Usually people think, smoking or, some sort of thing that led to lung cancer, without realizing that lung cancer and respiratory diseases could be caused by all sorts of different things, including just exposure to bad air outside, or genetic predisposition as well, and so on and so forth. Next, and maybe what teachers might be most interested in looking at with these lessons is whether what standards are met and if it meets the NGSS standards. And what I'll say is I really tried hard to have these lessons align with the NGSS standards, but truthfully, I couldn't do that with all of them. There's just, public health and NGSS, they just don't always have an overlap that's clearly defined. And so just keep that in mind. But I do try, I think there's at least 3 lessons that have an overlap with the NGSS standards. Otherwise, they meet other public health standards or health enhancement standards for the state of Montana. Great. Next. So this is a teacher's guide, and I really tried to lay it out as, simply as I can for teacher understanding without a whole lot of pre-preparation of reading through the whole lesson. That will take who knows how long. So this is really to kind of lay it out pretty plain and simple, what is required for the pre-lesson preparation, as well as, I break it down by slide as to what it is the purpose of the slide, and even an optional script if you don't want to really learn the material, you just kind of want to have it ready and present it out loud in the moment. That's an option here as well. Next. And so with these lessons, I also created the PowerPoint, and this is, I would say, a necessary thing because there are videos involved that I think are important for the students. But again, if you're only using a portion of the lesson, you may not even need the PowerPoint. But it is also to, one, help the teachers guide through the lesson, knowing what part they're approaching, but also the students. And with that, along with the teacher's guide, where I had the optional script, I've also put that in the notes of the PowerPoint, again, to try to help and eliminate any extensive pre-lesson preparation. And then this is an example of what the worksheets will look like. This is a student worksheet example, and then this is what the teachers will have with the answer key. And, Anna and Kayla and I were trying to figure out the best way to go about this. Of course, we don't want the answer key to land in the hands of the students. And so we're thinking if teachers want to use this curriculum and they want the answer key, that'll be a formal request they'll make in some way, whether it's through a portal, email, we'll figure it out. But it will be, we will verify that it's a teacher requesting these answers and provide the teacher with these. Okay, so let's do an example together, and we're going to really look into the Purple Air lesson, kind of a component of it. We're really not going to dive too much into it because we don't have enough time for that, but just kind of what the lesson is centered around. And that will be exploring the air in your community by using the Purple Air website. It would be great if everyone on this call could be a part of this activity. So what we'll have you do is go to purpleair.com, go to the map, which is kind of on the upper bar, and then click on the real-time map, which is it's part of a drop-down menu from the map. And so once you get there, let us know, give us a thumbs up, and then we'll kind of explain the rest of the steps here. And you can also click on the link in the chat that Kayla has provided as well if you want a more direct. Perfect. I see Sarah give me a thumbs up. Biga, awesome. Mesa do. Perfect. Awesome. Great. So once you're at the map, now I want you to find the closest air quality monitor to where you are in this moment. So go ahead and zoom in onto one of these circles, which are supposed to be an air quality monitor. And you'll see that there are all sorts of different colors. That's referring to the air quality index, also known as the AQI. Green means good. And as you kind of go towards warmer colors, it gets progressively worse. So I think maroon is the worst you can get. So once you get to your circle, click on it. And then you should see a pop-up with a graph. To make sure you are accessing the most accurate form of this information, go ahead and click on the little settings tab on the upper left corner of the graph. And then you should go to the option that says apply conversion, and it should do a drop-down menu and then do US EPA. This is a correction factor that is applied, and it helps. There is some bias when this isn't applied, and so this helps make it like 91% more accurate. I can't quite remember the logistics of it, but it does make it a lot more accurate if you want to use this information moving forward. So once you guys have that, it would be great to share either on the chat or go off of mute and let us know what, one, the air quality is in your community at this moment, and two, if you notice any trends throughout the week. And while you do that, I'll have Anna go on to the next slide. Perfect, thank you. So just to kind of talk about the Purple Air lesson as you guys are navigating your Purple Air website, what we really try to aim to do with this lesson is, one, to help teachers and students understand how to use the Purple Air lesson, but also to make informed decisions to better protect your personal health and community health. And in the context of this lesson, I try to do it like as an athletic director who wants to decide whether outdoor practice should be a thing on this day and what are the criteria that they should look at. So I'm really trying to make it, putting it into a greater framework of mind and see how it could be applied in real life. And I see people are answering. Awesome, Sarah. So 21. Okay, it's pretty good. Are you having controlled burns right now still? No. I think yesterday I saw one monitor there that was red, so I was wondering about that. Vika Mesa, were you able to get? Awesome. I picked monitors closest to my house and it's 13. Okay, thanks, Anna. Air quality there is really good. Okay, Mesa 10, Kayla 7, and Anaconda. Awesome.
This is Began. I can't get onto mine right now, but seems pretty good out here. Sorry
Oh,
about that.
no worries. Not a problem at all. Okay, thanks everyone for sharing. So we'll move on to the next part. So now you guys kind of have a feel of what this lesson is centered around, being able to allow students to use this map and make decisions and evaluate it, analyze the data, graph it, so on and so forth.
Okay, thanks, Kristen. We're going to take a quick moment now to shift gears a little bit. And our curriculum is being finalized as PowerPoint presentations, PDFs that can be printed and, hand filled out by students. But we know that that's not the most effective method to get curriculum to all of our teachers. Montana is a diverse state in terms of resource availability, of course. We have really small schools. We have a little bit bigger, but still small schools. And every school has different availability in terms of technology and so on. So we are going to ask that you contribute just quickly to this poll. Should pop up there. And it's going to be asking you a couple questions about what you typically use for student materials, and then what technology your students have access to. And the goal of us asking this again is to hopefully lead us in the right direction in terms of what will be the best way to get our curriculum digitized if we end up doing a more usable digital version. So something like a fillable form or Google form. We all swim in the options of best ways to get materials to folks. So this will help us. And we'll add these to the poll results that we got from our participants yesterday. And we'll ask those that watch the recording to share back with us just in an email or something so that we can get that from them as well. So thanks very much for answering that question. We'll keep trucking along here. And Kristen's next going to tell you about the curriculum spotlight component.
Yes, thanks, Anna. So part of what I hope to do with this curriculum, of course, is introduce public health, bring awareness to students about what public health is, but also realize that the health field encompasses so many different positions, careers, and I'm guilty to have assumed that that usually entails just doctors or physician assistants, things like that. But once going into the public health field, I realized doesn't have to be that kind of direct patient care, healthcare type atmosphere. It could be so much more. And so with that, I was hoping with these curriculum career spotlight videos, one, not only will it bring these professionals' experiences into the classroom, but two, make students realize that, you could have so many different careers in public health that doesn't always have to be direct patient care if you want to go into health. And so with that, we'll show a short video, and I'll let Anna decide how much of the video we'll watch because we want to respect your guys' time and make sure we end this meeting at around 5.
I'm an air quality specialist with Missoula Public Health, and my job depends a little bit on the season. In the summer, I track wildfires and wildfire smoke to see air pollution impacts on Missoula County. And in the spring and fall, I regulate outdoor burning, and I do a lot of other tasks throughout the rest of the year, including industrial permitting. My role is important for public health because air pollution is all around us at times, and it can have a real impact on people's health, especially those that have respiratory illnesses or heart and lung disease. And air pollution includes anything from pollution from industrial sources like asphalt plants, wildfire smoke in the summer, and wood stove smoke in the winter. Some skills I use frequently in my profession include analytical and critical thinking, especially when looking at meteorology and weather forecasts for outdoor burning. And I also use a lot of communication skills. I have to communicate with the public on different science topics and air pollution, and trying to communicate that in a way that people understand where air pollution is coming from and why it can negatively impact your health. To become an air quality specialist, my academic path included getting a bachelor's in environmental science and minors in biology and statistics. And then I also did a lot of fieldwork positions and internships throughout school as well as right out of school. And looking forward, I would love to get my master's degree in an air quality related field. My favorite part about being an air quality specialist is the fact that I get to work with the public and communicate with the public. I'm always learning new ways to tell people how air pollution can impact your health, and I love learning those little things about how people learn better.
Okay, thanks very much, Kristen, for all of your hard work getting those videos, recruiting folks for them, asking the great questions. They, to me, are one of the highlights of this project because they really bring public health to the students in a way that feels so approachable. And these people just are real people, just like them, just like us. And hopefully they can see themselves in some of that work and aspire to perhaps a career in public health or, any of the adjacent fields within healthcare or working to protect other people. So our next activity we have kind of designed as a breakout session, but given that we're recording this, it's a little difficult to do that as a breakout session. So instead, what I'd like to do is put in the chat. Kayla, are you perhaps able to throw that in there? Thanks very much. We have a document in one place that is cover sheets for the 5 core disciplines of public health lessons. So Kristen, mentioned previously that each of the lessons comes with a cover sheet or a cover page with the lesson description, with the background, and so on. And so we just put them all in one place and gave them a number real quick for purposes of this teacher workshop. So there's epidemiology, we'll have the number 1 next to it. You'll see when you open up that document in the chat. Environmental health will have a number 2, health policy a number 3, and so on. And so if we could each just take a lesson, read the just lesson description component, and then come back and just share quickly with the group what the gist of that lesson is. I think that will really help for folks watching this recording after the fact to get just a really quick introduction to what each lesson includes. So before I kind of break away for a moment and pause the recording, I want to make sure everybody is able to access that document in the chat, and then let's assign numbers here. So I'm going to put our team on the spot as well. Let's see, Sarah, are you good with doing breakout 1? Thank you. Epidemiology for Sarah. And Biga, are you able to access that? I know that website was giving you trouble.
It was in the website. I just was running around. I got
Oh.
the book thing. Yeah.
You got it. Okay, cool.
Yeah,
So are you
totally.
good to do environmental health? Number
100%.
two?
Thanks.
Awesome, thanks. Also, as a side note, there was a firewall for the Purple Air website at your school that we discovered with another teacher yesterday, Bika. So that could also be something you run into later on with the Purple Air website. So we'll try to work through that as it comes up. Okay, Mesa, are you good to do breakout 3, health policy?
Yep.
Thanks very much. And Kayla, will you do number 4, social and behavioral sciences? I see a thumbs up, thanks. And Tony, can we ask you to do biostatistics? Number 5.
Sure.
Okay, thanks. All right, I'm going to give us about 3 minutes. I'm going to pause the recording so that folks watching the recording don't have to wait through, and then we'll come back and share. Okay. So just real brief, let's go through just kind of the general description or overview of what each of these cover sheets told us about the lessons. So how about epidemiology? What did you get from that cover sheet?
So in epidemiology, I got that students will look at disease patterns and impacts through the role of being an outbreak investigator. And so they're going to be given different scenarios and have to solve problems and evaluate solutions to those problems.
Outstanding. Thanks very much, Sarah. And how about environmental health?
For this one, they focused mostly on air quality, and students were given graphs to analyze that helped connect the kind of helped distinguish between correlation and causation in relation to air pollution and respiratory health, and also combat some common myths around respiratory health.
Outstanding. Thanks so much, Bika. Appreciate it. How about health policy?
Yeah, the students will be introduced by like what health policy is and how WHO and CDC work with it, but also like their role in developing the process in their own community and addressing health policy issues that could be relevant in their own town. And then again, it kind of debunks misconceptions or preconceptions of health policy in the past.
Wonderful. Thanks very much, Mesa. And how about social and behavioral sciences?
Yeah, so this one, students will learn about the different health behavior theories and models, and then the importance that they have in guiding different health interventions in public health. And then they actually get to use all of those to actually like develop a real world health campaign and intervention.
Wonderful. Thank you, Kayla. And last but not least, how about biostatistics?
So save the scariest for last. So this lesson plan demystifies the scariness of statistics and biostatistics, and addresses basic concepts related to common biostatistical approaches for the investigation of health-related inquiries. More specifically, health research covers topics like developing null and our alternative hypotheses, determining causes for type 1 and type 2 errors of a study, looking at trends, identifying data relationships, and a whole bunch more.
Awesome. Thanks very much, Tony. And then, of course, as Kristen mentioned, there's also the introduction lesson and then that bonus lesson on interpreting Purple Air data and using that to make informed decisions. So thanks everyone for your participation in your brief highlight. That will help folks have a bit of an understanding of what to expect with the curriculum.
Thanks,
to wrap-
Anna.
Oh,
If-
yep,
if-
sorry, go ahead.
Yeah,
Kristen.
just because I saw we have a little more time than yesterday, so I do want to address a little bit something about the biostatistics lesson. Because Tony is right. A lot of people get scared of when they have to think about learning biostatistics. And if I'm being honest, even grad students have issues with biostatistics. It might arguably be the hardest course here at the University of Montana for Public Health. And so with that, I really try to take the approach with biostatistics as simply as I could, but it still might be some challenging for some students. So with that, if you want your students to have a challenge, biostatistics is a great option. Or if you want to really push your AP students or something, it's a great option as well. That's to say, I wouldn't start with that lesson probably. If you're trying to introduce this curriculum to your students, that might scare them a little bit. I also think it would be a great option for extra credit if you wanted to have that option for your students as well. Still a great lesson, still something very valuable for your students. I just wanted to give you a heads up that it is a little scary and it's something even grad students struggle with. So thanks, Anna.
Great perspective. I appreciate it, Kristen. Okay, so our next steps here is we will send you links to our curriculum very soon in its current format. So again, as I mentioned, that's like PDF, PowerPoint, and then we'll take the feedback that we receive from you all to determine how we next take our digitization of the curriculum, and then we'll also get that to you. If you have questions along the way, we know many of you won't be implementing any of the curriculum until next school year. You're probably hanging on through the remainder of this school year. We are here at any time to answer questions as you incorporate any of the components of the lesson. So if you run into any broken links or issues or questions about implementation, we're here to help through that. We would also love to continue facilitating connections with health departments in your area. So we have a network of folks that we work with, and we're excited to get them in touch with you if you have an interest in having someone speak to your class, either coming in to visit you if they're there in town or Zooming in or something to your class. And then we've talked a bit about the Purple Air in Schools project, an adjacent project that is working with the Purple Air monitors. And if you're interested in being a part of that initiative, let us know and we can connect you with those folks as well. And then just in general, any feedback you want to share at any time as you're getting started, we love to hear how you're using the curriculum, how you're making it fit for you. As Kristen mentioned, like we had a teacher who took our lesson and kind of flipped it upside down and made it into a relay race, which was really exciting for us to hear because we can also pass on those tips to other teachers. So I'm going to, or Kayla, maybe if she's already on it, we'll put a link to a quick survey from this workshop. Your feedback is helpful to us as we refine. And then I'll leave you with our contact information. You should all have access to Kristen and my emails, but just as a reminder, that's how to get a hold of us. And if you have questions at any time, please let us know. If you have questions right now, please feel free to stick on and ask your questions. Otherwise, we just ask that you fill out that survey. And thanks for spending your very precious time with us at the end of a long day and nearly end of the week.